Enrollment for insurance under the Affordable Care Act is open, and new this year, it will close in mid-December. Particularly for parents, navigating the system can be a challenge. And so we've got Mark Rakowski, Vice President of Children's Community Health Plan, with us this afternoon to answer a few questions. Mark, I guess the first things first, the big thing that changes is families have less time to choose which plan they wanted to get this enrollment done.
You're right, Vince. In past years, open enrollment ran for 12 weeks through the end of January. This week it started last Wednesday, November 1st, and runs through December 15th. For
families here in southeast Wisconsin, what other things have changed about so-called Obamacare?
Well, some things haven't changed. Obamacare remains in place. Individuals are required to have insurance or face a penalty, subject to certain exemptions. What's changed for many families is there are fewer insurance companies to choose from. In southeastern Wisconsin, depending on where you live, that may vary from 2 plans all the way up to 5 different carriers. But many carriers have expanded the options they offer. So there may be different benefit options, there may be different levels of deductibles and coinsurance. And obviously one big change for individuals who have to find a new carrier, they've got to make sure that their provider is in the network that they choose.
That they can keep seeing the doctors that they want to
see.
Let's talk about cost a little bit, because certainly it has been reported that some plans are skyrocketing in cost, but others are not. What are you seeing in the landscape here?
Well, I think people need to be aware there are maybe list prices and there are net prices. And so for many individuals who are eligible for premium tax credits, they may actually see a reduction in the premium they pay. Premium tax credits have gone up as premiums have gone up. And so depending on your income level, you may actually be able to find a premium or a product that's lower priced in 2018 than in 2017. Not the case for everyone, unfortunately. Those who aren't eligible for premium tax credits are likely going to see an increase. We've got some options for them that mitigate those price increases if they want to buy from us directly, for example.
What about the future of the Affordable Care Act? I mean, I suppose politically we don't know. How do you navigate this landscape, really being uncertain as to what's coming in 2019, say?
I think it's obvious that people need insurance. Just like we need auto insurance, homeowners insurance, people need health insurance and need protection for both preventive services and catastrophic situations. I think no matter what happens in Washington, D.C. or in Madison, that need is going to continue. It's just a question of affordability. I think we all agree health insurance needs to be as affordable as possible and as comprehensive as possible. And so the reforms that are coming will address that, but I still think there is certainly a place for a plan like Together with CCHP and for an individual exchange where people can buy insurance.
All right, Mark, thanks so much for the important reminders here as we come up on the open enrollment season, which again is now open and closes a bit earlier this year. For more information on enrolling in healthcare through the exchanges or on Children's Community Health Plan, you can visit the link section of our website, tmj4.com.